Thank you very much, and it's really great to be here and to talk about the topic of technology and poverty. Can I quickly get a show of hands in the audience to know how many of you have taken a class in economics? Okay, right. So I'm going to talk about some basic principles of economics to start us off with. Some of which, hopefully most of you who've done some economics will recognize, and then we'll go into sort of using that to help answer this question. But it's useful for me to know how many people have sort of had that basic understanding beforehand. So can technology solve global poverty? I thought I'd set myself a challenging question, a big topic. We'll see how far I get in answering it, but I think sometimes it's good to, ask big questions. I want to start by saying that by technology, I do not mean digital, right? So the definition of technology is about the application of scientific knowledge for practical purposes. And the pictures I have up there are two extremely important technologies that have already done a lot to help solve poverty. So one is about improved seeds and improved agricultural technologies, which, if you think about things like the Green Revolution, improving the yield and the resilience of seeds in the developing world had huge impacts, and indeed is still having huge impacts on poverty. So the story of the Green Revolution was really about taking technological innovation that had been designed to improve productivity in agriculture in the rich world, and tweaking that and changing that and taking that to the agricultural commodities in the poor world. So, there have been big improvements in wheat and rice and their productivity in the rich world, but countries in the poor world, in developing countries, grow different agricultural products. Their wheat is slightly different, their rice is slightly different, but you are able to take that scientific knowledge, apply it, and improve the productivity of agriculture in the poorer world, and you saw these big increases in yields, big increases in resilience. And so, you see the improved rice seed on one side and the unimproved seed on the other, and just how much difference in productivity you get. And it's not just about the farmers making more money. What you found when that technology disseminated was that there was more agricultural product, prices fell, and the poor are actually net consumers of food. So the fact that the food price fell in those areas was actually one of the biggest ways in which that technology led to reductions in poverty. The pneumococcal vaccine is the other picture that I have up there. And vaccines and health technologies have been hugely important in improving the outcomes for the poor. So if you look at the health of populations now in poor countries, they are significantly better than the health of rich countries when we were at that level of income. So if you look at somewhere like Ethiopia, the level of life expectancy in a country like Ethiopia is similar to what it was in the UK in about in the 1940s. And yet, the income level of Ethiopia is 1/10 of what it was in the UK at that time. And the reason for that is because poor countries have been able to utilize health technologies like vaccines that were developed mainly for the rich world, but have then been extended and used in the poor world. So at a lower level of income, they've managed to get a much higher level of health outcomes. So that's the kind of technology that has already made a huge difference to the developing world. So let's just step back and think conceptually about what technology is. So any output comes from the inputs. You know, this is a sort of standard economic model. The inputs of land, labor, and capital, we arrange and produce an output. And technology is about rearranging those inputs, taking different types of those inputs, different quantities of those inputs, you know, rearranging how we put land and capital and labor together and producing more output with the same inputs, right? That's what technology is. It's about the ideas about how to combine the factors of production in a different way to produce more output. And in that definition of technology, the big increase, so this is just, you know, a picture of GDP per capita in different countries around the world, and you see this huge takeoff in the increase in GDP per capita. That is basically driven by technological progress. You know, most of the increase, I mean, there's been a bit of increase in capital, but it's mainly it's about us learning how to use our factors of production more effectively that has driven most of that GDP per capita increase. And that is the biggest thing that has driven poverty reduction. Now, obviously, you also have to worry about distribution of GDP per capita, but it's hard to get poverty to fall unless you get that increase in GDP. So that's sort of trivially, then we're left with trivially, it's true that technological progress is the biggest driver of global production, of global poverty reduction. So I'm going to hone in on the problems here, which are what are the barriers to technological progress, and particular, what are the barriers to doing technological progress that is useful for poor countries? Because I'm going to argue that that is a huge problem. We are doing a lot of technological progress, but we're not doing the right technological progress for poor countries. Then there's barriers to the take-up of technology in poor countries. And then I'm going to finally end with looking at the promise of digital, which is an important part of technology, though, as I've argued, is not the only part of technology. So technological creation. And this is where I'm going to go back and talk about some of the basic economic principles, because I think it's important to understand the arguments that follow. So technology is a global public good. What do we mean by that? The definition of a global public good is something that is non-rival and non-excludable. So non-rival means that once you've invented it, anyone can use it for free, or the cost of anyone using it. And that's the real concept of an idea, right? Once an idea, you've got a new idea about how to arrange things differently, someone else using that idea costs nothing in real resources. They may have to pay for it because you may have patents, but actually to the world, the marginal cost is zero. Now, that doesn't mean that, you know, actually producing the new technology costs zero, but the idea behind it, someone else benefiting from that idea, costs zero. So you might have to pay for an iPhone, but the idea of having a phone that has icons, someone else using that idea, costs nothing. So the marginal cost of an additional person using it is zero. Non-excludable means that it's hard to stop people using that idea, right? So it's hard to stop people copying the idea of having icons on a phone. And it's precisely those two elements of technology, that they're non-rival and non-excludable, that the marginal cost of someone else using it is zero, and that it's hard to stop people using a good idea once it's invented. That's exactly why technological progress has driven that big increase in GDP per capita that we saw. It's a really exciting element of technology that once you've created, you only have to have the idea once and everyone can benefit from it. But it's also the reason that it's really hard to effectively get enough technology. Right? It's really hard to charge for technology in an appropriate way. It's hard to fund it appropriately because it's a global public good. So again, another bit of basic economics. This is a demand curve, price and quantity. And, a few people are willing to pay a lot for something, and as the price goes down, more people are willing to buy it. Just basically, demand curves for virtually everything, work like this. A company who's trying to sell a product will try and maximize that square, which is the price they charge times the quantity of people who will buy it, and they will try and maximize the revenue they get, price times quantity. But for the world, what we want to maximize is the entire space under that curve, right? Because when a company charges that price, there are some people who are really well off out of that price because they would have been willing to pay more for it. There are also a bunch of people who would be willing to pay something for the idea, but won't get it because the company is charging too much for it. And that's a deadweight loss. So as a social planner, as a government, as what we care about in the world, we want to maximize the space under that. We're willing to pay, we will get all the benefit under that curve, but if a company charges for it, they will only get the revenue. So a monopolist will invest in a new technology if the revenue is bigger than the fixed cost of inventing it. But as a world, we want to do it we want to invest in a technology if all of the space under that curve is bigger than the fixed cost of developing the technology. So normally, we pay for technology by providing patents which have this problem that the company charges a high price, very few people get to benefit from it, but we get lots of ideas because people make a lot of money out of the patent. After the patent ends, the price falls and many more people benefit from the idea. If we don't have patents, we can go immediately to the low cost. We can charge very little for using the technology. Lots more people benefit from it, but we get fewer ideas. One thing that we can do is provide government funding to try and pay for technology. Unfortunately, governments aren't always necessarily very good at paying for technology, and we have to think of better ways of doing that, but we do end up with more technology. So that's the end of sort of the basic economics of technology. I want to add, so a lot of people know about that basic problem of funding technology and ideas. I think what we think about too little is why it's worse for poor countries. Why we're not funding the technology that poor countries need. And that basic problem of the dilemma of patents is much worse for poor countries. So let me try and explain why. When we charge a high price for technology, which we need to incentivize people to invest in it, some people don't get the technology because the price is too high for them to benefit from it. Who are those people? The poor. So they're the ones who aren't benefiting from technology when you have a high price patent. If it's a technology that only is useful for the poor, it may be that the technology never gets invented because nobody would buy it at the high price that you would get with a patent. So you simply don't invent the technology because it's only the poor who will benefit from it. It's also the case that patent protection is weaker in poor countries, so companies may not want to design something because they fear they're going to be ripped off. There's also social pressure on companies because of that problem we said that the poor don't benefit from the technology under patent. There's social pressure for them to give away or reduce the price of something. So if you think about the arguments about charging for HIV drugs, there was a lot of social pressure on companies to reduce the price of HIV drugs for poor countries. And that made total sense because there were people dying because they didn't have access to those medicines. And once it had been invented, the marginal cost of providing those drugs to poor people in Africa was very low. So after the event, it made total sense to lobby those companies to charge very little for HIV drugs in Africa. But the lesson that drug companies might take away from that is, for God's sake, don't invent something that's going to be useful for Africa, because you're going to get a lot of bad publicity and you're going to be forced to give it away for a low price. And this is the time inconsistency problem with technology for the poor. After the event, you want to give it away for free. If you always give it away for free, nobody's going to invent technology for the poor. It is not an easy problem to solve. I would also add that most scientists live in the West. And inevitably, most scientists think about the problems that surround them. Any of you who've spent any time in a developing country know that the problems that people face are different, and how you solve them is going to have to be different. And so we spend an awful lot of time and energy solving problems for the rich world where the scientists live, and not enough time thinking about the problems of the poor world, because we're just not exposed to them. And even when people worry about and think about them, they don't think about them in a practical way because they don't understand how difficult it is to make things work. So an example of this is vaccines, which are exactly the kind of technology that works well in the poor world because they can be used in relatively unsophisticated health systems. So you don't have to diagnose people. You don't have to have a very skilled person delivering a vaccine. A drug, on the other hand, is you need to have good diagnosis. You need to have good doctors to decide how much someone should get, whether they should get the drug, etc. A vaccine, you just have to vaccinate everyone. It's much easier to deliver. So, but we invent many more drugs than we invent vaccines because we are used to delivering things in a health system that is more functional. Take-up of technology. This is a picture. You heard me excitedly telling you about the huge benefits from the high increase, the new technologies in agriculture, which has led to huge increases in productivity in agriculture in some parts of the world. Right? So this is by region, and the black line is developed countries, and the yellow line is East Asia and the Pacific, and the red line is sub-Saharan Africa. So you have not seen the explosion in yields, and that's improving now. This is somewhat out of date. We've seen much more increases in sub-Saharan Africa more recently, but it's still lagging by a long way. And one of the reasons for that is low take-up of technologies. One of those high-yielding seeds, appropriate fertilizers, etc. One of the reasons for that is we didn't invent the right products, right? You have seen much more technological advancement for wheat than you do for cassava, or the kind of sweet potato that is grown in sub-Saharan Africa. So it's partly because we're not inventing the right technologies. It's also because you see much lower take-up of some of those technologies in much of sub-Saharan Africa. But I think there are reasons for that are worth exploring. So this is a study of take-up of fertilizer in Kenya. And so the researchers tested using fertilizer in small amounts once the plant had already grown a bit, which is called top dressing, and they found very high rates of return for using small amounts of fertilizer at that point. And yet, only 30% of farmers were using fertilizer repeatedly in that setting, despite the high returns that they could make. Now, most farmers, if you asked them, said that they knew that fertilizer was a good thing and that they would get higher yields if they used it, but they couldn't afford it. Well, they owned assets, they got money at harvest time, you know, they could quickly get a lot more money if they used fertilizer. So was that really the answer? So this study looked at two possible ways of resolving this, using with an idea of behavioral economics in the back of their minds when they designed these programs. And they said, well, the problem is that fertilizer needs to be used at a point in time when farmers don't have money, but there's other points of time when farmers do have a lot of money. What if we tried selling them fertilizer at harvest time? And the result is that if you sell it to them at harvest time and give them a little bit of an incentive that, you know, you have to buy it now, you won't get as good a deal later, then the take-up, which was just if you buy it now, you'll get free delivery, the take-up was a lot higher. Interestingly, farmers recognize that they procrastinate and that they are, that if they put it off, they wouldn't buy it. Right? So farmers would self-commit to buy it now when they had money if you gave them structured in the right way. So not only was this evidence that farmers weren't buying fertilizer because they were, by the time they got to fertilizer time, they'd run out of money because they weren't able to commit to tie their hands to lock that money away to buy it later. But they also recognized that they had that commitment problem. And therefore, if you gave them a commitment device type scenario, they would actually invest in the technology. So this kind of procrastination behavioral story looked like it was one reason why farmers were not taking up the technology. This is another story that comes out of behavioral economics, which shows just how sensitive people are to the price of preventative health. And these are demand curves for preventative health products, different preventative health products in different countries, but they're all telling the very same story. So on one axis, I have the percentage of people who buy the product, and on the other axis, I have the price. And these are really small changes in price. The units, if you can't see at the back, go all the way up to $2. And most of the action is happening, you know, in less than $1 or less than $1.50. So simply changing the price of a bed net, which, you know, the cost of a bed net is $7. So, but you're seeing huge changes in take-up when going from, you know, half 50 cents to $1. So these are really small changes in price, and you're seeing really dramatic falls in take-up. So, you know, deworming, one of the studies that was quoted in the recent Nobel laureate announcement, take-up went from, you know, above 75% if you gave it for free to less than 20% if you charged 50 cents. So hugely price sensitive. But these are all preventative health products. In other words, they're things that pay off far in the future, but you have to pay for them now. Something that behavioral economics says we're really bad at doing. So putting any small grit in the wheel makes us, you know, unwilling to make small costs now for benefits far in the future. So there's certain types of technology that we won't take up because they give us the benefits far in the future, but we have to pay for them now. This is another example of using behavioral economics to promote take-up of technology. This is immunizations in India, and we looked at what often the story for why people don't get vaccinated is, you know, in the developing world, they're suspicious of Western medicine. They've heard stories that, you know, immunization is related to, you know, being sterilized. It's all a plot. It's dangerous. You know, there are social norms against it. That may be true in parts of the developing world, but for most of the developing world, what you see is a lot of people will get one vaccine and very few will get all of the vaccines. And if you really thought that it was a social norm thing and that people were scared of Western medicine, they wouldn't be getting the first vaccine. It looks much more like a failure to persist story when a lot of people get the first vaccine and very few people persist all the way to the end. And if you think about it that way, you come up with a different solution for how to solve it. Because what you're trying to do is not persuade people that vaccines are good, but to persuade people to keep coming back for yet another vaccine. And so what we did here was we looked at, is it a supply problem? People just can't access it. So we provided immunization camps where without fail you could get your kid immunized if you turned up on the first Monday of the month. And that increased the number getting the first vaccine. It did nothing to solve the persistence problem. Statistically, there's no difference between the red and the yellow at the end, which is the persistence to the end. What really made a difference was providing a small incentive to get an immunization. And that basically was if you think about immunization as the reason people aren't doing it is, oh, well, I'll do it tomorrow. Or, I've got a bit of a headache or it's really hot, I'll do it tomorrow. If that's the reason they're not getting their kid immunized, then a little bit of incentive saying, well, if you go today, you will get something today, is actually had a big impact. And that's what we find, going from 6% to 39% uptake was just with a small incentive. It's not just about money, though. It's also those costs that are stopping people taking up things that are good for them in the long run. It's also about convenience. So this is about taking up iron-fortified wheat, and there's a high take-up at the beginning, but it tails off drastically. And it tails off particularly for people who have to walk a little bit further to get iron-fortified wheat. So again, it's not that they object to it, it's just when it's hot, when they're tired, it's a little bit harder to force themselves to do something they know is good for them. A very similar story for clean water. So that basically is telling the story of when we think about technology take-up, there's a lot of kind of behavioral economic stories about some kinds of technology take-up which prevent us taking up technology that's good for us but has benefits in the long run. I want to add that those behavioral barriers are worse for the poor. Why? There's a lot of evidence that the poor are more subject to behavioral barriers than other people. They procrastinate more, they find it harder to take long-term decisions. That is not because they're bad people, it's because the conditions of poverty make it harder to think long term. It is really hard to think long term when you're hungry and tired and you've got pressures around you all the time. We can see that by people are much more long-term thinking just after harvest than they are just before, because they're not hungry. Right? So the same people can think better long-term when they're not hungry. Noise is another thing that we're increasingly learning, that the poor have to face a lot of noise pollution around them, and it makes it much harder to make good economic decisions. So these are things that we all face, but it's harder for the poor. So digital. First of all, I want to say digital is not simply an answer to everything. It's not always good. For all the students in the room, I don't know whether you're told this on your first day of class, but taking notes on a laptop, I see a number of people doing that here, you learn much less than if you take notes by hand. Nice randomized trial that tests that, including in the Army. Giving out computers in schools, now tested many places, doesn't improve test scores. Right? Just having a computer doesn't improve test scores. In fact, sometimes people find it makes things worse off because people are more distracted. Gamifying is not necessarily a good way to learn. This was a really nice trial I like. It was about teaching fractions, and you could do it in a gamified way, or you could do it the old traditional way of, learning about fractions as slices of pizzas. Who learnt more about fractions? The kids who were given the boring old non-gamified version of pizzas. So it's not always the answer. We need to test when digital is useful and when it is not. And people have now systematically looked, if I continue sort of the education analogy, people have systematically looked at when digital is useful in classrooms and when it is not. And the overwhelming conclusion comes about personalizing learning. Now, why is that? What we need to do is look at why people aren't learning. And again, this is a problem that is so much worse in the developing world. So this is data from India. And I mean, it's from an RCT, but this is just descriptive data. And it tells us something really important, and it's something that we find again and again in the developing world, which is, so this is, on one axis we have the level of learning that people have reached, and on the other axis, the grade that kids are enrolled in. So if you were staying on target at 9th grade, you would be learning at a 9th grade level. The first thing to note, and the grey dots are where kids actually are. All of them are below grade level, right? None of them are above the black line, right? In the first couple of years, a few of them are on the line, but nobody's above it. Virtually everyone by the end is well below the curriculum. Right? The curriculum is marching on, where kids are is well below that. And in 9th grade, we have kids at a 3rd grade level up to a 7th grade level. Right? So most kids are kind of at a 5th grade level, but they're being taught at a 9th grade level. That is a huge problem. And there is a huge diversity of learning within the class. So there's an approach called teaching at the right level, which is basically find out where kids are and then teach them at their level. Very simple, really. And there's lots of ways to do it. This is in Chicago, this is in India. Both have been proven extremely effective, neither of which are using any technology at all. However, technology is quite a good way of producing, of teaching at the right level, because it can adapt to the level of the child. You ask a question, you see whether people can answer it, and then the computer adjusts the teaching to how people have answered the previous question. So in that analysis of where technology was useful in the classroom, the overwhelming result, and these are all individual RCTs, looking at personalized learning, adjusting the level of what the computer teaches you to how people have answered the question, phenomenal results consistently. So what can technology add in the classroom? Well, we can provide individual, we can do it at scale. We can provide technology, if we're in a relatively richer environment, to lots of individual kids. But the main benefit is we can be teaching kids completely different things in the same classroom. We can be teaching ABC, what letters are, to one kid, and we can be, doing complicated algebra to another kid in the same classroom. That is the real benefit of the personalized learning, is the real benefit of bringing technology into the classroom. And that equivalent lesson is true in other sectors. So this is just some data on what farmers need, what's the soil composition, and therefore the different kind of fertilizer they need. And it's really different in different parts of this part of Kenya, but it's correlated. So if you get data from some farmers, you can then project what nearby farmers will need. So you need the individualization, but you can also learn a lot from, if you test some farmers, you can learn a lot about what are the different needs in the different parts of the communities where you're working, and then target information to those farmers of exactly the right kind of fertilizer they ought to be putting on their crops. So it's that ability to do it at scale, but in an individualized way, which I think is the real promise And here are a couple of other examples of doing that. So I want to conclude by saying, you know, in the broadest sense, technology is responsible for most of the improvements in living standards that we've seen around the world. And the poor have benefited enormously from those technologies, but not nearly enough, because we are massively underinvesting in technology that is suitable for the needs of the poor, because of the way we finance it. So we need more technological innovation that meets the needs of the poor. Digital is one of those forms of technology, and the real promise there is to be able to do things at scale, at low cost, but in an individualized way. And then I'm going to end with a shameless plug. If you have found this talk interesting, or even if you haven't, and you're an economist and thinking about a career of applying science to real practical problems, the Government Economic Service, which is what I work in, and is in DFID, but in also every other government department, think about applying to the Government Economic Service. We have a FastStream version, which is for, and DFID is for people with masters, but there's also, you know, other ways to get in. There's summer vacation class programs and apprenticeship programs for people who haven't yet done undergraduate. Okay, so I'm happy to take questions.